According to the WHO or the World Health Organization, any disorder which is included in a screening program should be based on a set of criteria, particularly incidence as well as treatability. Newborn screening is the process by which newborns are screened after birth for different disorders which may affect their long-term health and survival. Early detection and diagnosis help in early intervention and treatment, thereby preventing long-term disabilities like mental retardation, dyslexia, speech abnormalities, learning disabilities, and scholastic setbacks. There are many countries who have adopted newborn screening programs. India is still at a nascent stage. According to the WHO or the World Health Organization, any disorder which is included in a screening program should be based on a set of criteria, particularly incidence as well as treatability. In India, there have been pilot studies by the ICMR in different metros across the country to evaluate the incidences. While the exact data is not available, studies show that the incidence of inborn error of metabolism in India is about 1 in 1,000, hearing loss about 4 in 1,000, and congenital heart disease about 5 in 1,000. Accordingly, in India too, it is wise to start off with the most common disorders which are prevalent in the country, which include congenital hypothyroidism, congenital adrenal hyperplasia, glucose 6-phosphate dehydrogenase deficiency, and hearing loss. Depending on the incidence of particular hemoglobinopathies like sickle cell anemia in different regions of the country, that may also be included as a part of initial screening. Moving forward, more disorders like biotinidase, phenylketonuria, galactosemia, and cystic fibrosis may be added, along with amino aciduria testing as well. It is a very simple test. A small heel prick is performed on the child at the age of 48 to 72 hours, and the blood is collected on a designated filter paper in the form of a dried blood spot. It is then subjected to technologically advanced tests like fluorometric immunoassays, enzyme immunoassays, and tandem mass spectrometry. In case of a screen positive, it is important to repeat the test and also confirm it with a disease-specific confirmatory test. Early initiation of treatment, particularly by replacement of thyroxine in congenital hypothyroidism, then specific diet in phenylketonurias have proven to be effective in the long run than detecting the child late with this disease and letting disabilities set in. A study has shown that about 2% of newborn screened infants actually show severe clinical symptoms as compared to around 42% of kids who are detected much later in life. Around 27 million kids are born in India every year. NBS can give babies a chance to a healthy life. It is important for us to make newborn screening universally available. This will help us promote health equity and also reduce the burden of societal and economic costs on the country and individual families. Newborn screening can help save many lives. Thank you.